we realize if our neighbor will not be safe, our city will not be safe likewise. We need to cooperate with one another. There's an interdependence in terms not only of in terms of sharing data in the data analytics, but most importantly in collaboration in what action to take in order not simply to contain, but more importantly, how to treat those infected with the virus.
It is only the LCEs themselves who underwent this problem, who will be able to give us glimpses of their experiences as to how to deal with this problem. And I value very much this webinar because we will be able to understand and go through the experiences of our fellow mayors as to how they handle the situation in their respective cities.
Lessons learned, of course, yung fear, anxiety, apprehensions, ang hirap kalabanin yan. Kaya sinasabi ko nga dito in Bisaya, ayaw kahadlok, kabalaka lang. Sa Tagalog yan, huwag kang matakot, but you are correct to worry. We must worry because we don't know where the virus is. We don't know what will happen to us. We don't know what will happen in the future, but do not be afraid. Of course, teamwork is very crucial, lalo na sa social amelioration and social services programs. Partnerships, of course, very important. National level, salamat sa lahat ng agencies, OLE, DOH, DTI, maganda ang ating relasyon with all the national agencies. Of course, evidence-based decision-making. And again, there is now a debate whether we should go RDT first or proceed with RT-PCR. And I hope that we will be learning some lessons in this session. Of course, technology is always an ally.
This is, as I've stated earlier, this is a wake-up call for all of us. We have to unite. We have to coordinate and collaborate with the different agencies so as to address the situation. This is not the time to be complacent. This is not the time for any finger pointing as to what should be done, what should not be done. But we have to help each other. We have to say that we can fight. We will win this crisis.
I like that some of the mayors underscored the importance of low-tech because even though we are in Silicon Valley, we believe in common sense, and we believe that, you know, one big aspect that's being left behind as we go to high-tech and high-tech testing are the basics. And I'd like to underscore them here in closing, right? Washing your hands and proper hygiene definitely still needed. Social distancing, which we continue to underscore. Wearing masks, and Americans have had to adjust to this. They're not. I like that the mayor of Marikina mentioned comorbidities because in the United States, as we know, we have big issues with obesity, with heart disease, with cancer, and these are the ones that are complicating and increasing the number of deaths. Contact tracing, quarantine.
We continue to emphasize that during this time of COVID, the essential services that is necessary to continue, such as family planning, TB, and other programs in the Department of Health and in the Philippines, needs to continue and to ensure that we provide the necessary support through innovative approaches in these times of restrictions and in these times of challenges, particularly looking at innovations on how delivery of service such as the Nurses on Wheels in Rizal, where family planning supplies are provided to families, the encouraging and consolidating some of our the goods and medicines, not just for family planning, for other programs to be delivered to the different clients as in other cities such as in Davao as well.
So we, from Vietnam experience, we see that quarantine have a big impact on reduction of transmission. So any imported case from overseas has been quarantined in central quarantine facility, and from at the beginning, and then it stopped spreading in the community. So even though now we are receiving more and more Vietnamese coming from overseas, but we apply a very good quarantine system using this whole government approach. So that is become very efficient and effective.
We have already identified different bottlenecks in our laboratories. No? First, as I've said, the operational issues that had been hounding our laboratories for their day-to-day operations. And of course, the second would be our health human resources, which we know for a fact na there are a lot of those being affected, and also those people who are contractuals. No? So with this, we are now having these strategies, as I've shown a while ago. We need to expand their capacities, licensing more laboratories. Like in Region 6, sir, we now have 2 additional RT-PCR, one RT-PCR and one gene expert laboratory that are set to be licensed. They are in stage 3 already. So if we can expand our laboratories also per area, then we will be able to spread out and distribute well the zones that are now being catered to by our specific laboratories. No, so kaya that's why there is this longer turnaround time, because in Western Visayas we have just one Western Visayas Medical Center, which is our RT-PCR laboratory there. But if we expand it to more laboratories within a locality, hopefully the turnaround time would be lesser. Also, we would like to optimize the capacity of each of our laboratories. So there is this rated capacity, as I've said, but because of operational issues, we are not being able to optimize the capacity of our lab. So sana po matulungan din kami, no? The national government can be assisted by our local governments in directing also our laboratories, providing them with support so that they can optimize their capacities.